I'm not going to take that personally as I stand up in front of all of you.
No.
I'm just teasing. Thanks, everybody, for your time. CaptureProof is changing the face of healthcare one photo and video at a time. We're actually optimizing healthcare and removing everyone's favorite waiting room from that experience. How are we doing this? By applying social behavior to medicine. Each of those white lights on the left-hand side is someone taking an image to more accurately tell a story. When you have patients and data sets look like this, you can go in and find your patient and potentially see how they've progressed. But it doesn't take long until your data sets look like this. Just for a kind of benchmark, Mayo puts 2 million DICOM images into their servers every day. It requires an appointment, a huge machine, and a technician. These images are taken with what's in your pocket right now. CaptureProof does this through Capture, Curate, and Collaborate. We've launched a smart medical camera with computer vision. CaptureProof overlays the instruction from the physician, overlays a ghost image of baseline so that you can line up and get the same view time and time again. And over the past 3 months, have put in computer vision live in the active camera to highlight shadow and exposure. Curation enables 3 clicks to look at A versus B. A provider can know if the patient's getting better or not. And simply through the collaboration tool, give an update to the entire care team or let the patient know that they need to come in or skip the waiting room, stay home. CaptureProof published a study in the Journal of Telemedicine Telecare, peer-reviewed journal, with Kaiser, looking at the follow-up care for total knee. CaptureProof did asynchronous tele-rehab, incision site management, range of motion recovery. There was a 75% reduction of in-person visits. Again, 75% fewer waiting rooms. And we saved 60% of the provider's time. So everyone thinks, well, that's Kaiser. Why does anyone else care? Well, luckily enough, April 1st, Medicare decided that they are going to give one payment for total knee and total hip. Accountable care is here. Treatment is no longer a revenue center. It costs money. CaptureProof saves time, saves money, but even better, we got the patients to the same or even better pain scores in our study. We've had a 300% increase in orthopedics in the past quarter. CaptureProof analytics let you know, are your sutures still in your patient's incision? Is the patient on the right track? Is their range of motion actually what it's supposed to be? And are they achieving their goals? We've also taken this to the next step with triage and looking at the very time-constrained donor of transplant organs. CaptureProof is working with a European team, and our color and texture index is allowing this to turn into this. We are on track to positively impact 1 billion people's lives, and we are looking for partners to help us in this goal. We help you with clinical trials. We help your portfolio companies use our API, and if you're a health system, we want to help you give better care. Thank you. Person.
Hey, Macon.
Hey, Amar, how are you?
Good to see you. Congrats on all the great stuff you're doing here. You touched on this a little bit in terms of, I'm going to be Mr. Business Model today, in terms of the business model. How are you trying to capture some of the dollars in the bundles, and how have those, what have you discovered there from a pricing perspective?
Yeah, pricing's fun in healthcare, huh? So we have a turnkey solution that we do a subscription. And when we first went out and looked for edification of others, doctors are very concerned about how much data they're doing and how many patients they see. So with payers, we're doing a per member per month kind of experience, but direct into the provider's hands, and especially for the private orthos, it's $50 a month, unlimited use, unlimited patients, use the product, put your data in, and With $600 a year, they're making that back within 2 months of reducing 2 follow-up visits that don't need to happen or keeping 1 patient out of the ER, frankly. And we have studies that show we keep patients out of the ER with 1 photo by 50% post-op. It's actually post-spine surgery, that study. So having multiple allows you to really drop that down exponentially. And then we have API embeddable partnerships, and that's often based on business model of our partner.
So Jody Holtzman, AARP, so where does the FDA come into everything you're doing?
So we don't touch the patient. And so we are not bound by 510K. We are a clinical decision tool. Any sort of computer vision feedback on results, we're only providing back to the provider themselves, and then they are making their decisions on that. As we automate it, and if we go to roll it out directly to the consumer, then we would go a 510K route.
Hi. Just a quick question. So you mentioned ultimately the provider is going to be taking a look at that. How does that fit into their workflow? Is this something that they do in bulk at the end of the day? How does that fit with them?
Yeah, so let's just make sure we understand a provider doesn't necessarily mean an MD or a DO, right? So the provider oftentimes, especially in the ortho use case, is the lead call nurse. Low-level CaptureProof is a visual voicemail, and high-level it's a visual health journal. So now you have the opportunity to reassure a patient like never before when they're calling in and saying, my incision looks terrible. But yeah, it does, but it's day 7, and that's what a day 7 incision looks like. So having the opportunity to reassure that patient. So oftentimes, it depends on what you're looking at. If it's an urgent moment, then it might be happening just like a voicemail would happen or a phone call would happen. If it's seizures, then the neuro doctors are looking at the seizure videos at the end of the day, and it goes into a much more teleradiology batched kind of experience.
Thank you, Megan.
Thank you.